Hi, I'm here to talk about cervical collars, otherwise known as C-collars, how they should fit and how you can help a patient to adjust a collar or change the pads once they're dirty. So most of the cervical collars we use at the hospital are Aspen collars or Vista collars. So this is what the Aspen collar looks like. This is the front piece. This is up. The chin can rest here. This would be upside down. There's no place or no cup for the chin to rest in. If a patient, if you notice that the collar is not flush against the patient's skin, you can adjust the collar by pushing up on these tabs. They're plastic and they're bendable. So you can always modify it like that so it can fit more flush on the patient's neck. So the pads are gray on the outside and white on the inside. So you can see when the pads are getting dirty and it may be time for them to be changed. They should be changed when the pads start to change color or if you notice them to be wet. And it's all Velcro, so it's pretty easy. You just pull the piece off and then you have a replacement pad that you can put back on. We suggest not taking off both of the pads at once. I'll show you what that looks like. If you take them both off at once, it's difficult to know where you should be placing the new replacement pad back on. But if you just replace the top pad, it's a lot easier to kind of see. You can almost place it just back like it's a puzzle piece. Like that. And then for the bottom pad, tight Velcro. For the bottom pad, you can see it goes there. And you just match it up with the top pad. And the goal is that there should be no plastic touching the patient's skin. There are some areas that are open, that's fine, because those areas aren't touching the skin. Now the back piece is just one piece, and sometimes I find patients with it upside down. So you know it's upside down because the words are upside down. So this is the correct way. It's really hard to see, but there's also little arrows here that say up, but it's the same color as the plastic, so that's difficult. This has just one pad on the back, and to remove it, you just pull off the Velcro, and I'll remove it all the way. And when you're trying to line it back up, you just want the windows to match up with each other. So you have the window of the plastic match up with the window of the foam. And then there's a thread to lace the Velcro through, like this. Your pads and your replacement pads are not disposable, so if they get dirty, please wash them by hand and let them air dry. Do not dispose of them. And that's it. Next, we'll show you how it should fit on a patient and how to safely remove and place it onto a patient. Now I'm going to show you the correct fit for a C-collar, how to remove it, and how to adjust the positioning. Before you start to adjust the collar, you want to be sure that the patient is laying flat on their back, and you want to remove any pillows behind their head. And you want to direct the patient to look directly at the ceiling and to not help or move their head at all. So, Abby, look at the ceiling. Don't help me in any way. Don't move your head. If you notice she starts to move, just redirect her. And if you have a patient who isn't able to follow those directions, have an additional person to assist you in holding their head still. So you always want to just take one part of the collar, either the front piece or the back piece, off at a time. You don't want to take the entire collar off. So to start, I'm going to undo the Velcro straps, and I'm going to kind of stabilize the collar as I do it, so I'm not bobbling her head around. And the Velcro goes actually all the way behind back, so you have to go pretty far to remove the front piece. I'm going to remove the other side. She is doing a great job not moving her head at all. Okay, so this is what it looks like when the front piece is off. And this is where you might be able to help the patient to also wash their skin. It's important to check for skin integrity because a lot of patients' food bits get stuck in their C-collar, or they may be sweating a lot, or there may be an incision from a surgery that's draining and can make their skin macerated. And if the placement of the pads on the collar isn't in the right spot, there may be plastic from the collar touching their skin that may cause an abrasion. So it's good to do a skin check. Even if you don't think you need to change the pads, you should do a skin check every day. So to place the front piece on, we're gonna place it on her neck. And it's for people with slim necks, you actually really have to tuck it behind. So you have to pull the back piece aside so you can tuck it underneath. And we'll have to do another readjustment of that before we put the Velcro on. So now to remove the back piece of the collar, you want to press down into the mattress so as you slowly slide it out so you're not moving the patient's head. You can either slide the back piece of the collar towards you or away from you, whichever feels more comfortable. I prefer pushing away from me. So I'm going to push down into the mattress and I'm going to gently start to slide the collar out. And I want to be sure that her head is not moving. Then to find the right positioning to put the collar back in, you want to align the Velcro strap in between the ear, the bottom of the ear, and the top of the shoulder. It should be about mid-distance. Often your Velcro gets stuck to things you don't want it to. And I also tuck the flap under the extra piece of Velcro underneath so it doesn't scrape against her neck. So here I have it aligned with the Velcro on the front piece of the collar and in between the bottom of her ear and the top of her shoulder. Again, I'm going to push into the mattress and slide it gently so I'm not causing her head to move. As soon as it starts to poke out from the other side, I'm going to help it to come through all the way. And I just want to see that each side there's about the same amount of fabric from the collar on each side. Then to secure the Velcro, I'm going to tuck the collar flush against her neck and bring the Velcro up. Same thing over here. I'm going to tuck it flush against her neck and bring the Velcro up. It should be secure so she's not able to nod her head yes or no, and she should feel that it's pretty snug. Often patients find this is uncomfortable and they feel more comfort if they're sitting more upright in bed or sitting up in a chair when the collar is snug. So now I'll show you an example of how I often find patients that is an incorrect fit for the collar. Often the collar is on too loose and the patient's neck can slide below or their chin can slide below. This is causing the patient harm. The collar is not helping them in this position. Their food can get caught underneath there and it's not providing the security that we are hoping for it to. So if you notice a patient has a collar like this that's very loose, please tighten it up. Some issues to consider when you have a patient with a C-collar are that if the C-collar is not fitting properly after adjustment, is that you can consult the orthotics and prosthetics department. They're able to make adjustments to the C-collar and they have additional sizes and varieties of C-collar that may fit your patient if they have different anatomy or body habitus. It's important that prior to a patient returning home, if they are returning home with their C-collar, is that they have an additional pair of pads to go home with, so they can always have a clean pair of pads at home because the pads are not disposable and they need to be washed by hand and air dried, as we talked about before. It's also important that a family or member or friend go through family training before the patient leaves the hospital, so they can learn how to help the patient to adjust the collar and to switch out the dirty pads. The patient cannot change the collar themselves. There's no way for them to maintain their precautions and to be removing the seat collar and adjusting it themselves. If a patient lives alone and they are not able to have a family member or a friend assist them with this, we should consider setting up VNA services to have a nurse come in a couple times a week to assist the patient with their seat collar. The seat collar must also be worn while showering. So if a patient is planning on showering, there should always be somebody at home with them who's able to manage the seat collar during that time. They will get in the shower with their seat collar on, they'll do their regular shower routine, they'll get dried, they put their clothes on, get back into bed, supine in bed, no pillow behind them, and their family member or friend will assist them in removing the collar, taking off the dirty wet pads, putting on clean new dry pads, and adjusting the seat collar back onto the patient. There's never a time where the seat collar should be off, not during sleep and not during showering.